This is Tahniyat Aksa. I am a counseling psychologist, and today we're going to take a workshop on CBT.
Good evening, good evening. I want all of you to please open your camera. I'm going to do the same. I want all of you to open your cameras and switch off your mics for now. You can open your mic when I'll ask you some questions, or if you have any doubts or anything like that, then you can open your mic. But for now, close your mics and open your cameras, all of you. So let me start. Let me first introduce you to myself. I am Tahniyat Aksa. I'm a counseling psychologist. I live in Saudi Arabia, and of course, we are 3 years apart. This is why I said good morning in the starting, because for me, it's still the timing is different. So today we are going to talk about CBT. So basically, we are going to have a class on CBT from basic to advanced, but it will be all about CBT. Okay? So I want you to answer me first. What do you understand by the word CBT itself? Anybody who want to answer?
Uh, I think it's a cognitive we have heard about cognitive behavioral therapy, where it includes about the changing or restructuring the emotions of the individuals, identifying the negative emotions, structuring it or like behaving it in a positive way for maybe for coping, like that.
Okay, very good, Akriti. Thank you so much. When we talk about CBT, it is the most common therapy used in the psychological background. We as a psychologist, we use these therapy a lot, especially for the patient of depression and anxiety, but not the severe depression patients and the severe anxiety patients, because if you got a client who is suffering from depression or anxiety in a very severe mode, then we have to think about before giving the therapy, and we might change the sessions, the therapies, according to the client. So Aaron Beck was the therapist, the psychologist. He used to work with under someone, and he realized one day that everybody, like all the clients who are coming to us, they have it's not just the behavior which is the problem, it's their cognition, the thought process, the way they are thinking about the problem, that is what actually triggering. Thank you. Okay, all or nothing thinking, overgeneralization. For example, you're thinking too much. For example, if I go into a meeting, I'm taking this example of omitting too much, but then this is the most common example in the case of in such cases. That is why I'm using it. Okay, suppose I went into a meeting. My boss told me that the PPT you have prepared, it is lacking this part, and this part. It is not clear. This whatever. Okay. So what can happen? What all thought process can I have? I can have a thought process that my PPT was not good enough. Okay, I am not good enough for the post. I am not doing good. These can be my negative thought process. Right? When you talk about the thought process, there are two types of thought process, the positive one and the negative one. So basically in CBT, we focuses on clients who have negative thought process, but on the other side, we can also focus on the positive one, because eventually the work of CBT is to give you a kind of shift. We are going to talk about it, the cognitive shift as well.
They may even
Right.
show the self-harming behavior.
Thank you so much. अगर आपकी बिहेवियर में आज कोई आपकी हैबिट्स है, बिहेवियर है, तो क्या वो एक दिन में आया था? इफ यू हैव अ हैबिट ऑफ स्लीपिंग लेट इन द नाइट, तो क्या वो सिर्फ एक दिन में हैबिट आई आपके बिहेवियर में? टेल मी। नहीं आई।
नो
भी नहीं आई, तो क्या वो एक दिन में चली जाएगी?
नहीं।
Exactly. So it takes time. It is not a quick fix at all. Okay. Second assumption, CBT is only for severe conditions. जब आप बहुत बीमार हो, जब एकदम परेशान हो, तब आप CBT लो, वरना CBT की जरूरत नहीं। ये लोगों का assumption है, सोच है, which is wrong. CBT बेसिक सी चीज पे भी के लिए भी की जा सकती है। बेसिक चीज मतलब मैं बहुत ज्यादा सोच रहा हूं अपने फ्यूचर के बारे में कि मैं फ्यूचर में क्या करूंगा, मुझे जॉब मिलेगी कि नहीं मिलेगी. बेसिक चीज. I don't think there could be any more basic problem which we can face as an adult regarding our future. But what will happen tomorrow, if not day after tomorrow? Stop sharing as of now. Thank you so much, everybody, for participating in the class and taking participation, understanding. And if you still have any more doubts, anything, feel free, like I said, drop a message to the admin. He or she will forward the queries to us. We will address it in the tomorrow's class.